Good morning, ladies and gentlemen, and welcome back to the course on sports training, load management, and recovery. This is week 6, and we will be dealing with lecture 3. Lecture 3 deals with the diagnosis and management of overtraining syndrome. In the previous lecture, we have talked about overreaching, overtraining, supercompensation, and the allied concepts. And now let's see how we can diagnose and manage this case. I will be covering this lecture as per the following outline: introduction, history taking, exclusions and markers for overtraining syndrome, role of performance tests, role of psychological testing, blood tests, treatment prevention, tips for coaches, and conclusion. There is a strong demand for relevant tools for the early diagnosis of overtraining syndrome. There is no diagnostic tool to diagnose overtraining syndrome. Unfortunately, it is a diagnosis of exclusion, because if no explanation can be found for the changes in performance and mood of the athlete, overtraining syndrome is diagnosed. Early and precise diagnosis of overtraining syndrome is virtually impossible, because the only sign is a decrease in performance either during competition or during training, which may be absolutely normal or which may be due to a variety of reasons under the sun. Let's talk about the history. By obtaining a thorough history, a clinical diagnosis of overtraining syndrome can be determined if you can show decreased performance despite adequate rest, mood changes, and lack of other causes of underperformance. If the patient fails to recover after an appropriate rest period of at least 2 weeks, you may diagnose overtraining syndrome empirically. We have to identify events surrounding the initiation of the performance decline and get a detailed history of emotional and psychosocial factors, pressure of training, and onset of symptoms with relation to the training load. We have to get into the history and try and find out when exactly was the performance decline started and what were the factors which contributed to this performance decline at that period of time. The definitive diagnosis of overtraining syndrome always requires an exclusion. You have to exclude an organic disease like endocrinological disorders, thyroid, adrenal gland, and diabetes, iron deficiencies, infectious diseases like myocarditis, hepatitis, glandular fever, diseases like anorexia nervosa and bulimia, which are eating disorders. To diagnose a case of OTS, you must always exclude these diagnoses first. That means the patient has to be tested for these diagnoses also. You have to exclude such factors such as calorie restriction, insufficient calorie or protein or carbohydrate intake, iron deficiency, magnesium deficiency, allergies. You will also have to identify inciting triggers or events such as training errors due to an imbalance between load and recovery, monotony of training, too many competitions, psychological issues, emotional demands of the occupation, sleep disturbances, altitude exposure, and any exercise or heat stress. Please note, you will have to identify these triggers at the time when the performance decline started, and also identify whether these triggers continue even today. People have tried to look at markers for overtraining syndrome, but there are no definitive diagnostic markers till today. They say the ideal biological marker should be easy to measure, minimally invasive, affordable, and should not interfere with the training process. They might as well ask for the moon, because in reality, there is no currently available or suggested markers that satisfy all these criteria. Creatine kinase, heart rate variability, and blood lactate show some promise as part of a group of tests to identify overtraining syndrome at an early stage. There are several criteria that a reliable marker for the onset of overtraining syndrome must fulfill. The marker should be sensitive to the training load and be unaffected by other factors. Changes in the marker should occur before the establishment of the overtraining syndrome. Changes in response to acute exercise should be distinguishable from chronic changes. The marker should be relatively easy to measure with a quick availability of result, not too invasive and not too expensive. The marker should be derived from submaximal or short duration exercise so as there is no interference with the training process. As I said earlier, they may as well ask for the moon because none of the currently available or suggested markers meet all of these criteria. Blood lactate. It's a useful marker due to its inverse relationship to glycogen levels. It can be affected by the training status of the athlete. Numerous metabolic variables also affect blood lactate. Strength and endurance athletes with overtraining syndrome have diminished maximal lactate concentration. Please note we are talking about lactate concentration, not lactate threshold levels. While useful in identifying overtraining syndrome, lactate is not sensitive enough to rule out non-functional overreaching. CK and urea. Circulating levels of creatine kinase increase with eccentric and unaccustomed exercise and last for days to weeks. CK and blood urea levels may be accurate representation of muscular and metabolic strain, but they are not effective at recognizing overreaching or overtraining syndrome. They will only tell you that the muscles have acted. There has been strain on the muscles, but they cannot tell you whether it is overreaching or whether it is overtraining syndrome. Heart rate variability. It's another important parameter. Describes the change in the interval between consecutive heart rates. It is representative of the cardiac autonomic balance with an increased heart rate variability relating to increased parasympathetic tone. Overtraining syndrome individuals tend to have lower maximal heart rates and with increased heart rate variability when compared to healthy subjects. Simply put, if there is stress, heart rate variability increases. Monitoring athletes' heart rate before and during training sessions and comparing them with baseline values can be a tool to help diagnose overtraining syndrome. This means that you have to have the resting heart rate measurements for all athletes as a baseline. Hormone assays. Hormone-mediated central dysregulation occurs in overtraining syndrome, and measurements of blood hormones could help detect overtraining syndrome. Previously, a lot of us used to use plasma testosterone cortisol ratio to diagnose or to pick up overtraining syndrome. But it is now evident that this ratio only indicates the actual physiological strain of training and cannot be used for the diagnosis of overreaching or overtraining syndrome. In overtraining syndrome, a decreased rise in ACTH, growth hormone, luteinizing hormone, and follicle stimulating hormone has been reported. Leptin, insulin, interleukin 6, and metabolic growth factor insulin like growth factor 1 has been shown to decrease with overreaching. Hormones such as leptin, adiponectin, ghrelin, IL-6, TNF-alpha have been recently investigated for the monitoring of training. Early diagnosis. The two most important factors in early diagnosis of overtraining syndrome are monitoring heart rate and blood lactate. These two parameters alone are able to classify 89.5% of athletes who may be entering overtraining syndrome. By utilizing heart rate and blood lactate along with the POMS or rest Q sport questionnaires, the clinician can recognize overtraining syndrome and intervene early. Performance testing. The key indicator of overtraining syndrome can be considered an unexplainable decrease in performance. Hence, an exercise or a performance test is considered to be essential for the diagnosis of overtraining syndrome. Time to fatigue tests are more important because they show the greater changes in exercise capacity as a result of overreaching and overtraining syndrome. These tests, time to fatigue tests, are more important or more relevant than incremental exercise tests. To detect subtle performance decrements, it might be better to use sport-specific performance tests. Psychological tests. Part of the clinical diagnosis of overtraining syndrome includes mood changes. The profile of mood states questionnaire is useful to assess the early indicators of overtraining but cannot give information about the causes. The recovery stress questionnaire for athletes was developed to pinpoint mood disturbances related to training, and it is effective in identifying individuals at risk for overtraining syndrome. So, POMS questionnaire for assessing early indicators and REST Q sport questionnaire for identifying individuals at risk for overtraining syndrome. Psychomotor speed test. This is a new but promising tool in the early detection of non-functional overreaching. It's easy to use, non-invasive, and is resistant to conscious manipulation by the athlete, and it is cheap. Reaction time and attention tests are promising tools in the early detection of non-functional overreaching and for prevention of overtraining syndrome. There are some blood parameters which may be useful in the exclusion diagnosis: CBC, complete blood count, CRP, ESR, creatine kinase, urea, creatinine, liver function test, glucose, ferritin, sodium, and potassium. We must always test athletes for low-grade viral infections if they are experiencing fatigue and showing underperformance. Treatment and prevention. The treatment must be appropriate for the specific cluster of symptoms in each patient. Each patient may show a different cluster of symptoms, and each athlete needs a custom management plan to successfully recover. Major element of all treatment plans is relative or absolute rest, depending upon the severity of the symptoms. Regular recording of heart rate, blood lactate, and mood changes are the most effective tools for recognizing when an athlete is moving beyond overreaching into overtraining syndrome. Mood questionnaires should be given monthly to gauge how an athlete is coping with training or competition. Training logs should track the fluctuation in performance and recovery. During maximal exertion periods, please do blood lactate levels, and blood lactate levels should also be measured when the performance begins to drop. You may like to treat OTS or overreaching with antidepressants because they may be effective in diminishing the symptoms of overtraining syndrome and reducing recovery time. If the patient is experiencing sleep disturbances, trazodone or amitriptyline may be incorporated. However, be aware that athletes are under anti-doping rules and WADA regulations, and certain drugs may be on the prohibited list of the World Anti-Doping Agency, so you will not be able to give those to the athletes. And in any way, drugs should also be prescribed only by a physician or a psychiatrist. High carbohydrate diet can help prevent the development of overtraining syndrome and speed up its recovery. If you give carbohydrate supplementation, there will be a positive energy balance. It may replenish glycogen levels and keep catecholamine, cortisol and glucagon levels in check. There are several considerations which the coaches must take into account. Maintain accurate records of performance during training and competition. They must be willing to adjust daily training intensity or volume or allow a day of complete rest if the performance declines or if the athlete complains of excessive fatigue. Avoid excessive monotony of training. Always individualize the intensity of training. One size doesn't fit all. Encourage and regularly reinforce optimal nutrition, hydration status, and sleep. Be aware that multiple stressors may add to the stress of physical training. It is actually said that stress is cumulative. Treat overtraining syndrome with rest. Reduced training may be sufficient for recovery in some cases of overreaching. Training resumption should be individualized based on the signs and symptoms. Please communicate with the athlete regarding their physical, mental, and emotional concerns. Include regular psychological questionnaires to evaluate the emotional and the psychological status of the athlete. The athlete condition, physical, clinical, and mental, is confidential, so please maintain confidentiality. Make sure the athlete undergoes regular health checkups by a multidisciplinary team of a physician, nutritionist, psychologist, etc. And please allow the athlete time to recover after illness or injury. Take-home message. Overtraining syndrome could be caused by excessive training load, other stressors, immunological, neuroendocrine, and other physiological triggers. A primary indicator of overreaching or overtraining syndrome is a decrease in sport-specific performance. It is very important to distinguish overtraining syndrome from overreaching and other potential causes of temporary underperformance. You may use drugs in the treatment of overtraining and overreaching syndrome, but be aware that the athletes are subject to the World Anti-Doping Agency rules and regulations. No single marker can be taken as an indicator of impending overtraining syndrome. The most challenging factor in recognizing overtraining syndrome is that it usually develops insidiously over months. Regular monitoring of performance, physiological, biochemical, immunological, and psychological variables is currently the best strategy for early detection of overtraining syndrome. The 4 methods used to prevent overtraining are retrospective questionnaires, training diaries, physiological screening, and direct observational methods. There should be a checklist which might help the physicians to diagnose overtraining syndrome and to exclude other possible causes of underperformance. Please note, early diagnosis of overtraining syndrome during the overreaching phase is more beneficial to the athlete because recovery from overreaching takes a shorter period and recovery from overtraining takes a much longer period, and certain athletes may never recover also from overtraining syndromes. These are the references which have been used in this lecture. I strongly urge you to go through them, ladies and gentlemen. Thank you for listening patiently, and thank you for your time, ladies and gentlemen. In case you have any questions, queries, or any comments, please put them on the email flashing on the screen. Thank you, ladies and gentlemen. Thank you, and Jai Hind.